coming at you live with our first guest in the Pop-Up Studio. Would you mind taking a minute just to introduce yourself to the audience who's watching?
Absolutely. Thank you, Nick, and it's a pleasure to be here. My name is Kanishka Katara. I'm the Chief Digital Health Officer at Living Goods. And again, as I said, pleasure to be a part of this conversation.
So for those who may not be as familiar with Living Goods, can you tell us a little bit more about the work that you do and the interest you have in digital health?
Absolutely. So Living Goods, we are an organization who works in the community health space, and we primarily work in Kenya, Uganda, and Burkina Faso. We work with governments to enable the community health workers to give healthcare services at the last mile to the community.
That's great.
I lead the global digital health function for Living Goods, and my interest in digital comes from the fact that I'm a technologist. I'm a computer science engineer by qualification.
All
And I spent the last 20 years in this sector.
That's fantastic. All right, so we're here at day 2 of Global Digital Health Forum. Any big takeaways for you at the conference? What are some of the topics and the themes that are coming up again and again in conversation, or even just sharing a little bit about the plenary, which I know you all have coming up tomorrow, right?
We had a plenary
yesterday.
Yes,
Yeah, tell us about that.
Yeah. So I think just talking about the forum, it is incredibly exciting to have the forum happening in Africa for the first time. And Nairobi Kenya being our headquarters at Living Goods, we are so proud that this is happening here. I see a lot of excitement across the corridors, across the roads, across the buildings where ministries, the governments is hosted, and partners like us. I think there's a lot of momentum in the space around adoption of digital, which is going a long way in terms of transformation of the larger public health space. Coming to our plenary, so we did talk about how digital is proving exactly, a transformational element. It is not the only element, but it is proving to be a catalytic element to transform the public health, the community health space. I think the standout moment for me was to have a real, actual community health worker from the field on the plenary.
Exciting.
And it was so exciting to hear the stories which she shared with us and how she has been using the digital tools in the field.
And that was your goal, was to bring together decision makers and ministries of health with folks on the front lines who are really at the point of patient care to tackle some of these digital health challenges, but also look at some of the opportunities.
Absolutely, and we, bringing the donor perspectives, the implementer perspectives, as well as the policymakers, and to see when all of these efforts combine, this is the result, which is an empowered community health worker in the field.
So my last question for you is 3 words. What gives you hope as we turn the corner on 2024 and we look to next year, 2025, as a digital health practitioner, somebody who has been in this sector for 20 plus years, from the technology side, what is your case for optimism?
You said 3 words?
Well, I said 3, but I tell you, nobody's been sticking to 3. So I'll let you take that however you want.
Okay, so I think number 1, digital is default. Number 2, momentum. And number 3, demonstrable value. Let me expand on what I said. I remember when we started our journey as Living Goods 10 years back, we were amongst the first organizations to give smartphones in the hands of the workers. And we were skeptical ourselves. We were not sure how this will play out. And the larger sector, they were like, how will this work out? And look here where we are. The question that can community health workers use a smartphone in their hands is not even a question. Wow. It is the default, which is where governments have come on board.
So now what's the default?
That's the default, that you have to give smartphones to the workers. Governments have come and joined the bandwagon, and which has led to a bigger momentum, and we are trying to ride that momentum so that we can take it to the next level.
Right.
And if I can elaborate on my 3rd point, it's the demonstrable value.
Okay.
I believe that digital only works when every stakeholder in the ecosystem has something to take away, which is the system adding value to me? We see it in the non-health sector also. Interventions in Kenya like M-Pesa, people use it because it is adding value. It is creating value for the end product.
Demonstrable value.
Yes.
Yeah.
Similarly, for the community health workers, this is generating that value. It is reducing their time they spend in doing their work. It is helping them optimize the priority areas they have. And it is generating the right amount of data, which is now being used to help the policymakers think, at a macro level.
Well, listen, we thank you so much for your time, for joining us in the Pop-Up Studio, and we wish you really tremendous luck and good fortune in your work at Living Goods.
Thank you so much,
and
pleasure to be here.
Enjoy your conference.
Thank you for hosting.
Take care.
Thank you.